After your baby's born, we recommend skin-to-skin contact with your baby. Skin-to-skin contact is where you have your baby naked or just in a nappy next to your bare chest. You can have a cover over the top of you to keep baby nice and warm. But there are several benefits to skin-to-skin contact. One of them is bonding. Skin-to-skin contact releases oxytocin, and that's a love hormone, and that's really good for you and it's really good for baby. So doing skin-to-skin straight after delivery is perfect for bonding with your baby. We also recommend skin-to-skin contact so baby can get some good bacteria off your body. We don't know it, but we do carry some good bacteria all over, and having your baby on your body next to you will transfer some of that good bacteria to baby. Another benefit is thermoregulation. That means keeping your baby nice and warm. So if you have skin-to-skin contact with your baby, covered over, it will keep baby a lovely warm temperature, which is what we need after baby's born. It's really good to initiate breastfeeding in skin-to-skin contact. So having baby here is a perfect position for baby to sometimes naturally wriggle over to your breast and start feeding. Or some babies need a little bit of help. The midwife will be around, so you can ask the midwife to help you, and we'd help you get baby in a good position, start breastfeeding, but keeping baby in skin-to-skin contact. And if you choose to formula feed your baby, that's okay. We'd still say have skin-to-skin contact with your baby while you formula feed. So have baby held nice and close to you while you give that first feed. And another benefit of skin-to-skin contact is if your birth partner does it. And that can be when you're ready to get up and get a shower. You can pass your baby over to your birth partner and they can do skin-to-skin contact as well. It's sometimes a good idea for your birth partner to wear like a baggy hoodie that can be unzipped, and they can put baby down there and cover baby up, or they can strip off and we can cover them over with a blanket on labour ward and have skin-to-skin contact. Skin-to-skin contact should be as long as you want it really, but it's brilliant if you can do it for the first hour or at least up until that first feed, but you can do it for much longer than that or shorter if that's what you prefer. We recommend skin-to-skin contact when you're at home as well. So if ever baby's upset or you're trying to get feeding off to a good start or you just want that time to bond at home, again, strip baby off, strip yourself off, cover yourself over if you want to, and have skin-to-skin contact. It's really good for calming an unsettled baby. If your baby did end up going to special care, you can still have skin-to-skin contact with your baby when baby's ready, well enough and ready to do so. The midwife would take you around to special care and the nurses on there will support you in skin-to-skin contact because, again, it's still all the good benefits that I've just mentioned before. While your baby's in skin-to-skin, the placenta will still be inside and the umbilical cord will still be attached to baby. The umbilical cord is clamped and cut after at least 1 minute, and that's so that all the blood from the placenta that belongs to baby can travel back along the cord to baby. This is called delayed cord clamping. Your placenta needs to be delivered. Your labour is not finished until you've given birth to your placenta. There's 2 managements for giving birth to your placenta. There's active management and physiological management. Active management is where you will have an injection in your leg of oxytocin. The midwife will be with you, and the midwife will gently, while your baby's in skin-to-skin, the midwife will gently hold your stomach and she will gently pull the cord and the placenta will come out. The other management is physiological third stage. So when you have that, you have no injection in your leg. The midwife will still be with you. Having baby in skin-to-skin, breastfeeding helps release oxytocin, natural hormones, and you give birth to the placenta yourself while the midwife's with you. If you change your mind halfway through, if you start off on physiological third stage and you change your mind and want to have the injection, that is something that can be given. And the midwife will be with you all the time until the placenta's born. And then you can have a good look at it, ask the midwife, and she'll be happy to show you the placenta. Just going back to the cord clamping, the midwife will clamp the cord, but if you would like your birth partner to cut the cord, that's something that we can do. So just let the midwife know at delivery that that's what you want to do. So you've delivered your placenta, your babies have skin-to-skin, you initiated your first feed. The midwife will ask you if you're happy for baby to have vitamin K. Vitamin K is to prevent bleeding disorders in babies, and we do recommend that babies do have vitamin K. There's two ways that baby can have it. Baby can either have an injection in their leg, which the midwife gives, a one-off dose, or they can have an oral dose, which means it's in the mouth. And if you choose for baby to have the oral dose, they do have 3 separate doses, which can be given in hospital and then out in community as well.